Let's go through synovial chondromatosis. This is a benign condition that results in multiple intra-articular loose bodies. Synovial chondromatosis is a proliferative disease of synovium involving cartilage metaplasia of the synovium. The pathology is chondroid metaplasia of synovium, not neoplasia, and therefore it's benign. The mesenchymal cells in the subsynovial layer become chondroblasts rather than fibroblasts. They form nodules of hyaline cartilage protruding into the joint, being covered by synovium and eventually becoming pedunculated and connected by a synovial stalk. These nodules break free into the joint as cartilaginous loose bodies. There is a small risk of transformation to chondrosarcoma of about 1 to 5% incidence. The histology shows a central necrotic area which may be calcified with a peripheral ring of viable chondrocytes. The histology can make it difficult to differentiate from chondrosarcoma. Epidemiology. This is a rare condition. The condition affects males at a ratio of 2 to 4 to 1 female. Common in the 3rd and 4th decades. It's usually monoarticular. The most common location is in the knee, which is responsible for 70% of cases, followed by 20% cases in the hip, and then lower incidence in other large joints including the shoulder, elbow, ankle, and wrist. There are 3 stages to synovial chondromatosis. Stage 1, early, involves synovitis and no loose bodies. Stage 2 is transitional with both synovitis and loose bodies. Stage 3 is late with loose bodies and no synovitis. The clinical features involve an insidious onset of symptoms, including pain and swelling with loss of range of motion of the joint affected. There may be mechanical symptoms of catching and locking, secondary to loose bodies in the joint. Investigations. X-rays will show fine, stippled, calcified lesions, which refers to synovial osteochondromatosis or ossified lesions. MRI will demonstrate synovial proliferation and soft tissue lesions which are of the same intensity as cartilage. CT can also show the osseous or calcified bodies or densities which are pathognomic. Arthroscopy will reveal synovial proliferation with cartilage growing from the synovium in multiple loose bodies. Important differentials include those involving monoarthritis and those involving calcification. This includes septic arthritis, PVNS, tumoral calcinosis, hypercalcemia, synovial sarcoma, rheumatoid arthritis, and osteoarthritis. Management. Initially, non-operative management includes observation for mild symptoms without restriction and range of motion. Operative management includes early surgery with arthroscopic or open synovectomy and loose body resection to provide symptomatic relief of pain, swelling, stiffness, and reduced range of motion, and also to prevent secondary degeneration. Outcome. There is up to a 30% recurrence rate, and untreated synovial chondromatosis can lead to articular destruction and chronic pain. Recalcitrant symptoms can be managed with radiotherapy, and when there are degenerative changes, then joint arthroplasty may be indicated. Thank you for tuning in. That's another step towards acing ortho.